How big of a problem is hearing loss in children in India?
In India, the incidence is much higher, which comes to around 8 to 10 per thousand live births. In a country like India, some 70,000 children are born each day. Around 700 children each day who are born with some form of an hearing impairment.
I think people have trouble understanding compounding. So in those first 2-3 months, the difference might only be 1 or 2 words. It compounds.
It compounds.
So the less words you know, the less words you can know.
Correct.
And so that difference just keeps on
Correct.
growing.
You can pick up a hearing loss in a newborn baby, like a child that's less than 24-hour old.
I think people can empathize more with not seeing,
Yes.
but they cannot even imagine not hearing. I don't think that's possible for somebody to imagine what must it be like to live in a world without sound.
So blindness is a handicap that attracts empathy, but deafness is a handicap that attracts mockery.
There is an emergency happening in this country and it has to do with children's hearing. More than 700 children are born each day with hearing loss, and there is something that all of us should be doing to prevent it. In today's episode of Second Opinion with Dr. Sid, I have with me Dr. Shruti Bansal. She's an ENT consultant who specializes in pediatric hearing loss, that is, hearing loss in children. Shruti, a pleasure to have you here. Thank you so much.
Thank you so much, Siddharth. This is my pleasure to be on your podcast today.
How big of a problem is hearing loss in children in India?
Okay, so first of all, the Western data that always comes, and it has been quoted in every presentation possible that I've attended. It's like 4 to 6 per thousand children that are born, live births. But in India, the incidence is much higher, which comes to around 8 to 10 per thousand live births. And when we talk about live births, it may sound like just 8 per thousand or 6 per thousand, but understand, in a country like India, some 70,000 children are born each day. And when you do the calculation in maths, you realize there is around 700 children each day who are born with some form of an hearing impairment. A lot of this hearing impairment is pretty manageable. Just, early intervention or early diagnosis is what is all needed.
Yeah. Why is it so important to pick it up early?
So, understand one thing. Child actually starts hearing while he's in the womb of the mother. Your hearing system apparatus develops by 18 weeks, and by 24-25 weeks, child starts recognizing the sound. So when a child is born, he's already developed some auditory stimulation, right? So if a child, if you're not doing a hearing evaluation at birth, or if you're not picking up until the age of 1 or 2 years and waiting for child to respond, you are losing on so much time already. So there are a lot of data that have come up. Especially I would want to just quote more of Indian data, because that's the reality check for all of us, that there is a data from IAP which says that a child that is born with a normal hearing, and if you check the vocabulary of that child at the age of 3 years, it is on an average 700 to 900 words. Okay. Now, if a child is born with the hearing loss, which means he has lost the auditory stimulation from the womb till birth, and you intervene or you restore the hearing by some means in first month of life, the vocabulary of this child at the age of 3 years will be somewhere around 500 to 700, pretty close to what he should have, but not really 900 words. However, if you delay the diagnosis and intervention for 6 months, for example, if you are intervening at the age of 6 months and you check the vocabulary of this child at 3 years, it will drop down to 150 to 300 words, which is like a significant drop. And even worse is if you intervene at 2 years of life, which is the best case scenario in India. Like, we all are aiming that we should be able to intervene or do, cochlear implants or pick up all these things before 2 years or by 2 years of age. And vocabulary of this child, even if it intervened at 2 years, at the age of 3 years will be less than 50 words.
Wow.
So we don't realize what we are missing on. We are, because of the underlying neurological pruning that happens, lack of auditory stimulation to the auditory cortex. You, even if you're giving the best of the treatment to this child at the age of 1 year or 2 year or 3 year, you are never going to get
Recover.
back what is lost, so that is why we keep on saying that it's a kind of a neurological urgency, if not emergency, but you must know that you're not going to get it back.
This is so important because people don't really understand how language or knowledge is built in the brain.
Right.
So, for you to learn anything, you first need to learn the abstract concepts inside it.
Correct.
Right? So, if I have to teach you that this is a phone, you need to first understand what this is a phone means, those
Right,
words.
right.
And if you cannot hear me, if you're not able to hear those words,
Right.
you will not form any structure of meaning
Correct.
in your head. And so what you might form is a very visual kind of word
Yes.
representation,
Correct.
but you cannot communicate.
Right.
And this leads to a significant impairment in the way that these
Correct.
kids will
Yes, certainly.
just navigate through life.
Very true, very true. So when I say that when you lose on auditory stimulation or when you lose on hearing, you're just not losing the ability to acquire a language or speech. It comes with lot of cognitive abilities, it comes with lot of emotions. Like for example, I always tell my young parents who come, like for example, have you seen a baby when he's crying, the mother is saying, oh my baby, please calm down, cutie, ye wo." That is such a soothing voice.
Yeah.
And if you have to use the same words in a different jargon, calm down,
Yeah.
don't cry, that becomes a different. So it's the words are same, the language is same, the vocabulary is same, but what comes with the speech or the communication is also the emotion, which gives so much of, it's just more than the emotional stability, it gives the whole personality or the existence of a child. So
Yeah.
a child that is born in a family which is full of lot of attention and love and good conversational rich language environment will be a much smarter child overall.
Yeah.
And in much stable child as a human being compared to somebody who's coming from a family where these emotional components were not there.
Not there.
And speech is a very important part of our emotion.
Yeah.
So they are losing on that thing.
Shruti, one thing that I've noticed is you see some people who are socially awkward.
Right.
So that means that they are in society, somebody says something to them, they don't really know how to respond.
Correct.
So that skill of being able to listen to someone's voice,
Right.
understand, is this sarcasm, are they angry, are they
Correct.
upset, those soft skills can
Yes.
only be picked up through communication.
Correct.
So I feel like maybe kids who've grown up in a joint family,
Right.
with lots of conversation going around,
Right.
lot of people, maybe arguing, laughing, discussing things, their understanding of society would be better than a child growing up with just mom and dad, both of them going to work, the child is on the phone all day,
Right.
there's nobody to talk to.
Right.
Their social skills might get affected because those language centers are not getting developed.
So on that note, Siddharth, I don't know if you have heard about this word called virtual autism or a digital autism that is coming into picture, is exactly because now both parents are working, smaller families, children are spending most of the time with nannies who are not communicating, they are always on the digital media. It is causing a kind of I always say it's like a language robbery that is happening. They don't know how to express, all their attention and emotions are going into something which is so unreal. And we all have seen there is a increase in autism post COVID, because during COVID they were most affected because they lost on all the form of stimulations they were getting, whether it was going out, talking to 10 other people, understanding things. So what I'm trying to say is, a child that is born with a hearing impairment is just not born with the impaired hearing. He is getting deprived of so many things in life. For him to become a normal mainstream individual, you need to get them back on track and give them their, at least this is the basic right that they should be coming to.
One misunderstanding that parents have is that a child who is a good student is somebody who learns.
Right.
So they only focus on the input that the child is getting. As long as the child is able to absorb things, that's a good child.
Correct.
But language doesn't work like that.
Right.
Language is give, take back, give back, take back, give back. So
Correct.
it is a constant cycle back and
Right,
forth.
right.
And that I feel is happening less and less with today's children.
Right.
There's
Certainly.
only intake.
There's only intake,
Yeah.
and they are just expected to, perform, read, see digital videos, and just perform. What we are looking at is our responsibilities just more than, diagnosing and treating children with if they are born with lesser sense, one's lesser sense is, more responsibility towards society, because we have to live. Imagine us, in a if 700 children are born every day with some form of a hearing impairment, and they are not really taken care of, and this data is very, very superficial, because we all know how the data maintenance happen here. So I think we are looking for a bigger problem in the future than what we are already facing.
Let's take a deeper dive into hearing loss. If there is a parent who comes to you with a child who they suspect has a hearing problem, on on average, how old would that child be when the parents bring the child?
So, so if you know, a child actually starts responding or speaking few words by the time he's 1 year old.
Yeah.
Parents still wait, and between 1 to 2 years is when they, realize that something is not right.
Yeah.
I would not. I would say that the age is coming down. We would get these children initially at the age of 4 years, then came down to 2 years. Now children are coming between, at around 1 year of age, because there is an awareness which is spreading. But more than that, I would say, even if they pick up that the child is not hearing, they really don't come up to find a solution. They just want us a reassurance, because they have already come from a background where the family, the relatives, the society, or even their GPs, and in some cases even their pediatricians have said it's okay. फादर ने भी लेट बात किया था, बच्चा भी लेट बात करेगा, कोई बात नहीं. And they are just not ready for us to, say that no. So the fact is, I tell them that with all due respect, I want to be wrong. I wish I'm wrong when I say that your child is not going to hear, but get me a hearing test.
Right.
If you're now, we have such good audiological services, such good tests available, that there are chances of false positive is just not there. If your hearing test says that you have a severe to profound hearing loss, which is not sufficient for the child to acquire language, you have a hearing loss. You wait for 1 year, you wait for 2 years, you're just wasting on that time. Right?
And as we just discussed, that time is very precious.
Right.
Because waiting for hearing loss for those 2 years at the age of 1, 2, and 3 is very different from hearing loss at the age of 13, 14, 15.
Correct.
Because it's like if you imagine a building is being built, those
If your
first 3 years is foundation.
Yeah, correct.
If that foundation is
Foundation
not built, everything, the entire building will be shaky.
Yes.
Right.
So I had a very interesting and a very heart-touching thing. There were two families, both the parents. So one parent were from a smaller town called Ratnagiri, and they came from a religious background where it was believed that if God has given you some handicap, you're supposed to live with it. But then this parent had seen another child who had received a cochlear implant, and he said, no, I want an implant for my child. They came. The child was, I think, 9, 10 months, 11 months old. And I counseled them that, earlier we do, better it is. We have already lost precious time. And that father was very determined. And he said, let's start the process. And even Siddharth, unfortunately, even if, you come up with all the resources, all the tests, everything is done within 5 days, the child is not eligible to get implanted for good a month, 2 months.
Wow.
Because there is a lot of things that need to be done before that, right? So, but that this family was very good. They did everything. On the same day, another family had come, and their child was much younger, 6-month-old, belonged to a very good family from Jaipur or somebody, very affording and everything, came with the grandparents, and grandparents kept looking at me as if I'm trying to, just don't say such things. And girl child, don't say such things. And they said, no, we'll wait for some time, we'll wait. I kept on telling them, but they decided to wait. Finally, this child got implanted at the age of 1 year, the first child. The second child continued waiting and taking some treatment, going to some, other things. Now, again, after 3 years, this child came up, the child who had got implanted, and this girl was talking like a absolutely normal. She was reciting poems, she was talking to me, and this family had come down, and they said very proudly, they said that we want to go for the highest end implant, you know.
Right.
This family, we helped them through funding, they got a basic implant, they were doing so. I mean, when we talk about these basic implants and high end implants, these are like it's like a phone, good phone, expensive phone, but the phone will do the function. It will
Right.
give you hearing. So they're very proudly standing outside. We want a bilateral implant
The
and
second family.
second family, and we want this thing. And when they looked at this girl, who they had met on day one, this child was talking, and then they looked at their granddaughter. She was still, you know, so dependent on the family. And I told them, and I could see that regret in their eyes, that now when you see both these children at 6 years of age, you will realize that that girl is actually 6 years of audiological age,
Yeah.
but your child is so delayed. So that is what I keep telling all the parents, that it's not about the resources, it's just the willingness. Like, do not get into this trap. You're missing on that important time.
I think people have trouble understanding compounding.
Yes.
Whether it's in stock market or whether it's in mutual funds,
Very nicely put.
and whether it's in ear damage or
Correct.
language development.
Yes.
So in those first 2-3 months, the difference might only be 1 or 2 words.
Correct. Right.
But it compounds.
It compounds.
So the less words you know, the less words you can know.
Correct.
And so that difference just keeps on
Correct.
growing.
And the sad part is, in this area, unlike stocks, once you cross that age of 5 years, 6 years,
Right.
you are not going to acquire language. We come across a lot of children who are 7 years, 8 years.
Right.
They want to do it, and we counsel them that we will be able to give you a perception of sound. Like,
Yeah.
he'll be able to differentiate between that this sound is loud, this sound is not loud. But language acquisition, that's not going to happen.
Shruti, I have to ask you a question that we had not discussed previously. Between vision loss and hearing loss, what is the more profound impact?
Okay, that's very, very interesting question. As I said, so first of all, I believe that all the sense organs given to you by God
Yeah.
have their own beauty
Correct.
and own importance. But when it comes to hearing loss, as we said, you are just not losing on speech, or you are losing on a lot of other things which are essential for your well-being, for your communicate. For you to exist, for you to able to talk. And I think, Siddharth, I don't know if you know, but this is the only technology in the world, cochlear implant, that has been able to restore a sense organ that has been lost.
Right.
So if you're born without a vision, you cannot restore a vision. If you're lost without, you're born with loss of sensation over the skin.
Yeah.
This is the only sense organ or the only sensation that can be restored. So that's a beautiful revolution that has happened in the industry, that this is the only thing that can be restored. So, I would still say, both vision and hearing is lost, but sometimes we come across patients who are syndromic, who are going to eventually lose their vision, and they are going to have a hearing loss, and we emphasize, please restore their hearing, because vision is something that he can still manage. He can still manage, with other things. But this thing is very important for his confidence, for him to just work his life through. Yeah. So blindness is a handicap that attracts empathy, but deafness is a handicap that attracts mockery. And another thing is that, your blindness separates you from things, environment, but deafness separates you from people, from the environment. Like, so it's a vision loss is more of a thing, materialistic detachment that you are getting, because you're not able to see, you're not able to touch, you're not able to. But deafness, you are just cut off. And this is a very, very, this is thing that we have really realized, that I have so many of my colleagues or people I know who have hearing loss, and they don't want to show up because they will be mocked for it. They will be called names. But if you are blind, or if you have this, people want to help you. People are more empathetic towards you.
Yeah, I think people can empathize more with not seeing,
Yes.
but they cannot even imagine not hearing.
Right. Right.
I don't think that's possible for somebody to imagine what must it be like to live in a world without sound
Yes.
from birth,
From birth.
right? Because what is it like to not know what sound is? I don't
Correct.
think you can imagine.
Right.
Whereas blindness, you can imagine it because you can close your eyes.
Yes.
You can
You go off to sleep.
you go up to
can
sleep.
shut.
You're in a dark.
Yeah.
You're scared of the
You
dark.
play games where you just put a blindfold
Yes.
and see how it feels, because it's kind of it's an experience.
Yes.
But you can't for that
Imagine.
matter, when some patients come to me, especially those who have conductive loss, and they're like, nee, we don't want to do anything, I just tell them, okay, sit across me, let's talk, just close your ears. Let's just talk. You'll still be able to hear me, you'll still be able to, but try and understand that it's so difficult. Or what I do is, especially for my older patients, sometimes when they come, I keep talking to them and I keep scratching something like a really something which means that is a constant thing which they're not able to, and then like, can you stop it, can you I said, that's how your child is hearing. There's a constant
Like an irritation.
And he's here understanding that you're talking to him. He understands that you're talking about this subject, but he can't make out, he can't make out what you're trying to say. So this is a very frustrating feeling. Like, a hearing loss comes with a lot of frustration, because you are just not able to understand what people are saying to you, right? You're not able to connect with them at any level.
And ear problems are such that I always feel that ear and tooth problems, they are so close to you.
Yes.
Like if my hand is hurting, I can still somehow put some distance.
Yes.
Say that, okay, my hand is hurting. But when I have an earache,
yes.
or when I have a toothache, I just feel like there is no gap between me and the pain. It's just so
It's so
intensely
intense
personal.
and it's so close. And in fact, a very funny thing is, before I took ENT as a subject, I always thought people don't have ENT issues. And even if kya hai, sardi khansi, how can that be distressful? But now when I'm deep into it, I realize, like, when a patient comes to me with earache, or sometimes, when they have a blocked ear because they've taken a flight or they have gone for scuba diving, I'm very empathetic towards them, because I tell them that you have no idea how painful and distressing that is, because you feel that pain deep inside somewhere in your brain, and you can't even press it, or you can't console yourself.
Nowhere to hide.
It's a really, and I make sure that I give a emergency treatment to these patients, because now I know that it's a very distressful situation to be in.
I do a lot of diving. I've completed 90 dives so far, and in 2 months I'll finish my 100th. So I have a lot of diving friends. So I want to put this message out there. So if somebody has equalizing problems,
Correct.
right? They go down 10 meters,
They-
pressure is too much, they're trying to equalize and it's not happening. Are there things that they can do beforehand to make equalizing easier?
So I'll tell you something. It's basically, in a very simple word, it's a tube that connects the middle part of the ear to the back of your throat or back of your nose. The purpose of that tube is to equalize the pressures, right? If you're not able to equalize the pressure because the external pressure here is higher, all that you need to technically do is basically, it's like a muscular tube. Eustachian tube is a cartilaginous muscular tube. You need to exercise that tube well. So a lot of these Valsalva maneuvers, there are devices which you can do basically to exercise that, so that whenever you want to really do it, your muscles there are strong. In fact, now we see lot of patients, old age, stress related, they come with these issues where their ears are getting blocked. They have, and it typically very distressed looking patients, very irritable with life, because they're not able to tell what's happening with them. And for that matter, this thing, when it comes to children are not even able to tell. When they have a blocked tubes, which is very common, they tend to develop fluid in the ear. They don't know. They are hearing, but they are hearing as if they are hearing underwater, because now their middle ear is filled with water. And then they develop infection. So these are, with children now, that's why, I have a very special interest in pediatric ENT, because children are very different. They are not mini adults. Their problems are different. Their way of expressing that is different. The way they feel it is very different. So it has to be treated differently.
Today, we are all living with gadgets. Children, especially, I think from the age of 2 years, they have an iPad, they have a phone. So they are listening to a lot of sound which is really close by.
Yes.
Maybe they're also using headphones.
Correct.
What is the harm in this?
So, especially when you're using earbuds, you are kind of occluding your ear canal.
Yeah.
You are giving a very high intensity sound which is directly stimulating your eardrum, which was not supposed to be stimulated that closely, because when God gave us this crevices and shape of the ear, it was very strategic. The ears are just not placed like just laga diya. It was very strategic. Where should they be placed, at what height they should be placed, what should be the shape of the ear, because the sounds which are coming, they are filtered, they are kind of focused, and then there is a whole mechanism in your ears to dampen that sound, so that sound that actually reaches your inner ear is non harmful. You are taking away all that benefit by putting something here and constantly listening to that thing, and you're just taking away all the benefits that God actually gave you. So when these patients come to me, I always tell them, if at all you want to wear, you wear those
Over the ear.
over the ear ones. At least something is getting distributed evenly. Don't put
Right.
anything inside. And for that matter, we are coming across a lot of children with these noise induced hearing losses, which is a very typical losses, high frequency losses, that typically at one frequency the hair cells are damaged. So
And
understand,
that's because of inner ear.
inner ear, yeah,
Like inside the bud.
inside, if you're using very high frequency
Right.
for a very long time, your hair cells are so hair cells are like, they are like machinery which is functioning. They have to convert the sound signals into electrical signals. If you're constantly bombarding them with signal, they are just going to get exhausted and then they die off,
Okay.
right? So I mean, this is a very I always say that technology comes with lot of side effects, which you will not see immediately. You'll see the good part of it, like benefits of it immediately. Side effects का study आता है 15-20 साल के बाद.
It's so ironic that we are using noise cancelling earbuds
Yeah.
while putting noise directly into your ears.
So what is happening is everybody is trying to shut the external noises in our life.
Right.
You don't understand what is happening inside, and that is the main thing at different levels. And I'm just not talking about the noise from the noise point of view. It's like children generally, when we were talking about smaller families, when we were talking about social isolation, like when we were kids, we would go and play in neighbor's house, इधर जाते थे उधर जाते थे, सब लोगों से डांट खा लेते थे सब लोग. So that was kind of giving us a kind of a social security. Now people are just becoming so, they're cancelling out everything outside, but internally the damage that is happening is at a bigger level.
So, Shruti, a parent has come with a child with a hearing loss. What are the options that that parent has to help the child?
So first and foremost is we need to confirm that the child has a hearing loss. Then second is, what is the type of hearing loss? When I say type of hearing loss, the hearing loss can be a simple hearing loss where the problem can be conduction of a sound from your eardrum to the innermost part of your ear. Okay. Another type of a hearing loss is a sensory neural hearing loss.
We should show that.
So if you look at this diagram, so this is the outer ear and middle ear.
Yeah.
So the sound waves get conducted, they enter the ear and then hits the eardrum.
Yeah.
Then the sound waves are amplified. These are the ossicles. And then this is the inner ear. Once they reach the inner ear, this is the ear which is known as, now if there is a problem from here to here, it's called a conductive hearing loss. This can happen due to any obstruction in the external canal. More commonly, if there is anything in the middle ear, it can be an infection, it can be fluid, or it can be a simpler thing, right? Then comes the innermost part of the ear. This is known as a cochlea. Okay, this whole thing is cochlea, correct? The function of cochlea is the whatever sound waves reaches the cochlea, it converts the sound signals into electrical signal.
Correct.
This yellow thing that you see is the nerve fibers, okay?
Yeah.
So then those electrical signals are given to this nerve fibers and then they are carried to the brain, to the part of a brain that. So now if there is a problem from here to here, it's a conductive loss. If there is a problem from here to anywhere here, suppose if it is not able to convert or if it is not able to carry the sound, then becomes a sensory neural losses. The treatment for the two are absolutely different.
Yeah.
Now a conductive loss can be treated
Correct.
with
So
medication.
hearing loss ultimately means there is sound reaching till there is sound reaching till the ear,
Yes.
but our brain is not able to hear it.
Correct.
So somewhere between the ear
Ear.
and the brain, there is some issue.
Yes. Yes.
So that issue could either be conductive, which is from the outer ear up to the cochlea,
correct.
and sensory, which is cochlea onwards.
Correct.
Right. So now you're telling me the
So-
treatment for the outer part.
Yes. So now what can be the problem? Suppose if you have a child is born without a proper formation of an external canal. It's called microtia. Okay. So the ears are not formed. Now when the ear is not formed, you have to see whether just the pinna is not formed or whether this is also not formed, whether half of this is not formed, whether inner part is also not formed. Now when the problem is with the conduction, you can give a simple hearing aid. Now the hearing aids can be now, if your pinna is formed and there is a problem in conduction within, you can put a hearing aid. Hearing aids does a simple job of amplifying, giving a louder sound. It's like a loudspeaker. Louder sounds, so that whatever function this pinna was doing, now it is happening here. It's a simple thing.
Right.
Now, if you suppose the pinna is also only not formed or this external ear is not formed, then where will you put a hearing aid? Then comes something known as a bone conduction hearing aid. I don't know if you've all realized, you don't only hear from your ears, you also hear from your skull.
Yeah.
Okay, your skull plays a very important role. So especially, I don't know, you, because you dive, if your ears ever get blocked, you kind of feel a echo.
Absolutely.
It's more like, आपको खाना चबाने की भी आवाज आएगी, yawn करने की भी आवाज आएगी. Those are internal sounds now, which are now conducted by your bone or the skull to your cochlea.
Right.
But
I heard something very recently that was so interesting. Most people, when they hear their own voice on video,
yes,
they'll find that this is odd.
yes,
And the reason is that when we speak, we are hearing our own voice
Yes.
through mainly bone conduction.
yes.
Whereas when we hear it on video, it's through air conduction,
Air
and that
conduction.
sounds different.
Yes, yes.
So you don't realize how you
Yes.
sound until you
Yes,
see your own video.
True, true. So air conduction is better or more than bone conduction. The moment anything obstructs your air conduction, you can utilize your bone conduction to hear, but the best is to restore your air conduction. Now there can be surgeries which can be done for your middle ear, like a myringotomy grome. When the fluid gets filled here, what you do is take a small nick, just suck out all the fluid and put a small tube so that the fluid can, it's a simple small procedures which can be done as a daycare, and you can restore the hearing. And these things are very, very common in children, especially early school going children, because of the underlying enlarged tonsils adenoids. So when your tonsil adenoids are big, this is the tube, okay, this is your eustachian tube, it opens into the middle ear. This end of the tube is blocked by tonsils and adenoids.
Right.
What happens, that secretions are not able to drain.
Come on,
It
so
gets
it gets
filled with
stuck.
fluid. It's very simple thing. It's filled with fluid, so your child is not hearing well. And because of that, his scholastic performance is going down. You simply either you remove the tonsil adenoids or you take out the fluid and put a tube here. Very simple thing to do. Now, the main thing which is more troublesome or thing which is not picked up is the sensory neural hearing loss. Mostly children are either, it's a congenital hearing loss which the children are born with, or they may acquire a hearing loss, like especially children who stay in NICU for a very long time, children who have a very high jaundice, requiring blood transfusions, children who are on a lot of oxygen therapy in NICU. So that's why these children are known as high risk children. Certain drugs like ototoxic drugs which can damage the hair cells,
Right,
and this can happen even, a lot of TB medications are known to cause damage the hair cells. So that is where this part of your thing is not functioning, right? And then when you have problem here, then the treatment option is, if you have milder degree. So another thing is, first find out what is the type of the hearing loss, then you find out what is the degree of the hearing loss, whether it is mild, whether it is moderate, whether it is severe, whether it is profound. For children with mild to moderate loss, you, even if it is a hearing loss here, you can still use a hearing aid, which means again, whatever leftover hair cells or leftover apparatus is working, you are trying to overstimulate it by giving a hearing aid. So cochlear implants are not meant for every child born with a sensory neural loss.
Right. So in the first sentence, we said that around 700 kids are born with hearing loss each day, but not all of them will want a cochlear implant.
Not all of them will need a cochlear implant.
Right.
Our job is to find out who are these children, because then we need to cater to them on priority. Right? Because they are the ones, so children with severe to profound hearing loss, Or the best thing to say is the children who are not benefited with the hearing aid are the candidates for cochlear implant.
But that would mean wasting a little bit more time though.
I would say wasting or utilize. You need to be like
Utilizing.
little proactive with them. You
Right.
can't. That's what I'm saying. You can't do the evaluation and decide tomorrow that okay, he's a candidate for cochlear implant. But these are the children that are really requiring more attention from our side.
Understood.
Right.
Now, out of 700, on an average, how many kids are actually eligible for hearing aid versus how many of them need to go for surgery, need implants?
See, I would difficult to give you a data like that, but
Yeah.
I would say it's like, for example, if there are 700 children, I would say around 350 of them would be with a simple conductive losses,
Okay.
which can be treated with bare medical treatment or this.
Right.
Rest 350, I would say 150 of them will benefit from hearing aid. Actually, needing cochlear implant will be 150 only.
Right.
But I mean,
Even
I
that
would
is a
say
big
that is a
number,
big
though.
number. That is, every child is equally important. And
Yeah.
we, you know what I don't see when we say hearing loss is not a visible disability. You can use this term as a very victimizing term, or you can use it to your advantage. Is that these children are actually otherwise normal.
Right.
They are absolutely normal. They don't have any other handicap. If you can restore or give back them the hearing,
Yeah.
they can become a normal individual. They are not somebody who needs handicapped criteria, or
Yeah.
you need to take care of them all throughout life. When this thing comes up that the cost of cochlear implant is very high.
Yeah.
It's a very the process is very tedious. I always say, like, when we mentioned about stock, look at the returns. Don't look at the investment. If the return is good, which means if you are able to convert a child who is always going to be dependent on you because he'll be deaf and mute, to a child who can be a normal individual, do go to a normal school, get graduated as a professional, earn his own income, and give back to the society, it's a much bigger return, right?
Can you talk about the investment part a little bit, which is how expensive is it to go for something like this?
So I would say that cochlear implants are expensive. The average cost of an implant in India starts from somewhere around 6.5 lakhs and goes up to 19-20 lakhs. And this,
Right.
I'm talking about one side implant. You have a bilateral hearing loss, so you have to multiply it with two.
Got
So on an average, your parents end up spending some 10 to 12 lakh for getting a bilateral implant, to up to 40 lakhs. But so I always had this thing with the company. I kept on saying that why your implants are expensive, why are you not reducing the rate? It has been in industry for such a long time. Only when I visited their facility in Australia, and I realized that these people are working so hard on the research. Their mindfulness is 20 years ahead of us, which means the implants that they are making are forward compatible, which means even the implant that is done today will be eligible for a technology which will come 15-20 years down the line.
And do these people have to, the patients who undergo this, do they have to get another one later, or one implant lasts a lifetime?
That's a very tricky question, Siddharth. But I will say that since it's an electronic gadget, the guarantee warranty that comes with an electronic device worldwide cannot be more than 10 years. Having said that, all the patients that we implanted 20 years back are still using the same implant, and they are able to upgrade the processor, which means, I'll tell you in a very layman language, there are two components of cochlear implant. One is an external component, one is an internal component. Internal component is one which is surgically implanted by a surgeon. Okay, that's just an implant that will work what the cochlea was doing, right? Then
That's the one you were saying was as thin as a strand of
yes,
hair.
it's as thin as a strand of hair. It's that thin. And trust me when I tell this, I saw how they do it. Every person who works in that facility for cochlear implant, they do that manually. They sit there and manually do it. They wear very high magnifying glasses, and every 2 hours they have to take a break, and they have to, like, they're always in that PPE kit because the sterility and the hygiene part is at another level.
Right.
So that's what I'm saying. When we say about the cost, it's just not a money making business we are talking about, because it's the kind of technology, it's the only technology that has been able to restore your hearing, so
Yeah.
so much goes into the research. So what happens is the external component is called a processor that you wear outside. It is the thing, it acts like your penna. It picks up the sound, it converts the sound, and it gives that sound via magnet to the internal component, which is then carried by the electrode, which is implanted in the cochlea, and the function
Wow.
happens. The external processor is upgradable. It's almost like, how ऐसे हमारे आईफोन के अपडेट्स आते रहते हैं, so that is updatable. You can still have the best of the technology even 15 years down the line with the same internal component, because when the company made those implants, they thought of it that maybe 10 year 15 year down the line we'll be able to come up with something,
Yeah.
so
That's really impressive. I have never really, I mean, I don't think most MBBS or MD students learn about this.
Yes.
This is a very niche thing. But the more I talk about it, I realize that it's very important that people know that A, early hearing loss detection is important.
Correct.
And B, that there is hope.
yes,
So once you know that there is hope, I feel the urgency of it somehow even becomes more. Because somewhere I feel that with vision loss, for example, even if you pick it up early with certain degenerative vision loss cases,
Yes.
what can you do?
what can you do?
So it's
Except-
almost like, okay, early detection would maybe, of course, you can take care of things a little bit more, but
Yes.
ultimately there's no way to solve it.
Right.
But in this case, that's not the case.
Yes,
So
certainly.
those few years are
Those
so
few
precious.
years, or I would have started coming to months now.
Yes.
That first few months of life are very, very important. In fact, WHO and the whole society that works, initially they used to say the criteria was 136, which means you pick up a hearing loss by 1 month, confirm it by 3 months, and intervene by 6 months, which has now come down to 1 to 3.
Oh,
So
wow.
1 month, confirm your hearing loss by 2 months, and by 3 months you intervene. And with the better technology, better anesthesia, better this thing,
Yeah.
we are able to do the surgeries in much younger children. Like
Yeah.
in Australia, they have implanted a child as young as 6 months old.
Okay.
Yeah.
Now we are in the realm of science fiction, but is there a way to pick up hearing loss when the child is still inside the womb?
No.
No.
Not yet.
Not yet. But that would
is
be
coming up.
Hmm.
It is coming up, but not much is known about it. They are trying to figure out.
Okay.
But the good thing is you can pick up a hearing loss in a newborn baby, like a child that's less than 24-hour old.
Tell me about that. Tell me about
So-
newborn screening.
So very straight. So all developed countries have something known as a universal newborn hearing screening, which means your baby will not be allowed outside the premises of the hospital until you have hearing report attached in your file, and you have a baby bassinet in your car. Okay. Like they're very particular about extreme things,
Right.
but which is a good thing. However, in India there's nothing like that. There is
Right.
nothing like a universal newborn hearing screening. Universal newborn hearing screening means you need to pick up a hearing loss in a newborn child. Very simple test. It's known as an OAE, autoacoustic emissions. It's a one-click test. There are probes that goes into the child's ear. One click, and you can just say whether your child is hearing or no. It
Right.
comes as pass or refer.
Right.
If your child pass, well and good. If it is a refer, you need to work up on that child more. And then there are more sophisticated tests that can help you understand the frequency specific hearing loss.
Right.
Like whether it's a conductive, whether it is a sensorineural.
Yeah. But as a screening, that's all you need to know. Normal hai ki abnormal hai.
Correct.
That's it.
That's it.
And-
And that is very doable, very easy, very simple.
Okay.
And you will be so much more confident when you know that your child has passed.
So, as an ENT specialist, is it your recommendation that every single child born in India should undergo a newborn hearing screening test?
Certainly, without a doubt, it has to be a norm, and there's no second thought about it. You cannot say that no, I don't want to do it, and I'm sure my child is hearing. Nobody can be sure whether the child is hearing until there is a report which is attached which says your child has passed the test.
Brilliant. Because I feel like after listening to you, if suppose from today every newborn child gets screened, that means that every day potentially around 700 kids with
Will
hearing
fail the
loss
test.
will get picked up, and potentially that is 700 people who would have been disabled after 10 years, 15 years, who have now a chance of living a normal life.
Living a normal life, certainly.
And the price for that is incalculable.
Yeah.
But even if you try to calculate, it's in millions.
It's in
because
millions,
each
because-
person will contribute so much.
Correct.
Yeah.
That's what I was saying, that's the concept of returns.
Yes.
You don't go, and in fact, I'll tell you something very personal, Siddharth. When I started working very closely with this, the only limitation from my community was why would you spend this much on doing a hearing test for 1,000 children? You're picking up 6 to 7 children. Why should we screen 1,000 children? What is the amount of money that got wasted? So what I did was that for 2 years in my hospital, for every child that was less than 1 year, because newborn was not, I couldn't see myself doing a newborn screening, but we did everything for free. Despite all of that, what I realized that it is not one person or one community that can do it, because even if you're getting picked up, what next? Do we have resources? Do we have infrastructure? Now suppose if universal newborn hearing screening has come into place, which is the dream for all ENT community, 700 children per day, do we have resources to cater to them? 700, like what next? Where do they go? What kind? And then they need a high-end auditory testing. Do we have that many pediatric audiologists? Do we have that many referral units that can take care and actually segregate these children, that which child needs to be under observation, which child needs to be put on hearing aid, which child needs to be worked up for cochlear implant? We don't have that.
This is so unfortunate because it's very similar to what is happening in mental health.
Yes.
Awareness of mental health problems is now at its peak, right? Everybody knows about anxiety, depression. But then what?
Then what?
When somebody says, okay, now what do I do? And we say, oh, you should go to therapy. Do we have enough resources?
Correct.
Do we have enough qualified, experienced therapists in the country to handle all the patients who are going through anxiety?
Yes.
The answer is no.
No.
And so it's almost as if, what was the point of me knowing then? Now it's even worse, in fact.
Now it's worse. Now you know that your child has a problem, and now you know that you don't know what to do. Like, there are a lot of patients who come from these remote areas. They have files and files of hearing tests and investigations done. And I was like, you knew your child had a problem at 7 months. Why did nobody told us what next? They kept on saying, wait for 1 year, we'll repeat this test after 1 month, we'll repeat this test after 2 years. This person told us to wait. And it feels so unfortunate that despite of them picking up the hearing loss, what next? So I think the whole community or the government needs to come together to put these things. Like I always say, we were able to eradicate polio because we attacked at it from every possible end. For example, AKT, you can't say कि we'll give you 1 month of AKT and बाकी का 5 महीने आप खुद दो now, because now we have told you have TB, now we have told the medication works, but then बाकी का तुम देखो. You had to give them this 6 months of TB treatment free. That's how you were able to control the TB. So everything that you are dealing with, you need to do it as a holistic thing, and it cannot happen just like all of us keep talking about universal newborn hearing screening. I feel it's just the tip of the iceberg. There's a much bigger problem sitting down there.
I think that this conversation was really important. In second opinion, this is what we try to do. We try to take a topic and just sort of highlight all the things that doctors should be talking about, but we don't.
We don't, yes.
Really. And so many times in the series, I have gotten surprised. After 15, 16 years of studying and 6 years of practice, I still come across things that I'm like, wait, if I didn't know that,
yes,
of course, no, people would not. So these are niche topics that are not really niche.
They're not.
It
not
affects
niche.
everybody.
It affects everybody.
Right. Dr. Shruti, noise pollution is one of the leading problems that is happening in the country, in the world right now. So what is the damage that noise can do? And also, what is the difference between sound and noise?
Okay, let's first talk about sound and noise. It's a beautiful thing actually. Sound is when there is different frequencies are in harmony with each other. I am trying to talk to you.
Yeah.
It's a sound.
Yeah.
I shout at you, it becomes a noise.
Okay.
Noise is an unpleasant experience, which is where one frequency or certain frequencies are more than the rest of the frequencies. So
Okay.
noise is used for a term which is unpleasant because the frequencies are not balanced with each other. Sound or is like a balance of different frequencies where you're using different consonants and vowels to give a meaning, which your brain can soothingly accept. So
Interesting.
that's the difference.
Yeah, because I always thought that it was the meaning. So sound is noise that your brain can make sense of.
Yes.
So that could be like a harsh thing.
So
It
yes,
could
I
be
mean,
similar.
on a lighter note, we say that a wife may be just talking, it may be a sound, but husbands may feel it's a noise.
If
right?
they are fighting.
Yes. So yeah, I mean, so it's but otherwise, like definition wise, like noise is something that's unpleasant, and it has a, there's a more emphasis on certain frequencies
Right.
which are unacceptable and not a routine thing for your ears to hear, right?
How big of a problem is noise pollution? How does it affect the hearing?
Noise pollution is becoming very relevant, especially because of the urbanization, because of we are constantly surrounded by some form of a noise. For example, there's a construction going on. The flights, like I stay in that area, Bandra Khar. I don't want to live somewhere near that Santa Cruz Juhu area because there's so much of sound pollution which people are not recognizing. It can be damaging. It's a constant high frequency sound of the planes that is going above you. Then another thing, of course, as we talked about it, that because of the earbuds that you are using, it's a constant noise exposure at a relatively higher frequency than normal, which is kind of bombarding your hair cells. Then comes a different kind of a noise pollutions, like a bomb blast or a train accident, or maybe somebody has hit you very hard. So basically one loud frequency sound which has suddenly kind of damaged your hair cell, or kind of moved your hair cell. So now more and more people are coming up with, initially the noise induced hearing loss was mainly occupational related, people, the laborers working in the train industry, people working in metal beating industry, those people, and they were supposed to wear those protective earplugs and all. But now I think we all are surrounded with some form of construction related, horn related, or with all that urbanization that is happening, we are perpetually being, on that note, more and more younger adults are now developing hearing loss at a early, that age related hearing loss. So with age, your hair cells also become aged. They also become less functional, and you develop something known as a presbycusis or an age related hearing loss. And we have seen that their overall average age is coming down.
I had once done this test where you can hear certain frequencies, and as the frequency goes up, you stop hearing it at one particular point.
Yes.
And depending
It must
on
be
when
scary.
it was, so I'll see if I can show it to you.
Yes.
So this is these are the different
There's the
frequencies.
extreme ends of our hearing.
Okay, if you can hear 8,000 hertz, you're both alive and not hearing impaired. But let's keep raising the
Okay,
frequency.
we are alive and
Yes.
you're not hearing impaired.
Yes.
8,000 hertz, everyone should be able to hear.
See.
We are here.
12,000 hertz, I can hear it. You can hear it?
Yes.
Okay.
I can hear it.
15,000 hertz, I can hear it. 16,000 hertz, I can't hear it.
So
Okay.
we have a 20-year-old.
We have a 22-year-old sitting in front of us, and he's doing like
able
this,
to
so he
hear
can
it.
hear
Can
it.
you hear
but
it?
yeah. 17,000 hertz, I can't hear.
You can.
18,000 hertz, I can't hear. 19,000
I've gone
hertz,
deaf.
I can't hear.
How high could you hear? If you could hear.
Okay, so this is very sobering because you realize that age is a thing, and
Age
it
is
is
a
not just a number. Your body does keep score of how old you are, and
Yes.
this means that certain hair cells in my ear has stopped working.
Yeah, they are aging. They're aging.
They're aging.
They're aging. Yes.
Yeah, so
which also brings us to this really it's a reality check that So that is what I was telling, that the average age of developing an age-related hearing loss is coming down, and because now we are living a more fulfilling life, which means the average professional age is going up. For example, like my 50-year-old grandmother had actually stopped doing much of work. I mean, with respect to being active, she really looked 50. Like now, my 60-year-old mother doesn't look like a 60-year-old. She's like all up and about.
Yeah.
People are running marathons at 70. So the average professional age is going up because of a better understanding of life, better medical facilities that are available. So we are actually waiting for a kind of a big chunk of people who are going to come up, especially our
Yeah.
parents and eventually us, that will develop an age-related hearing loss in life, at much earlier age,
And still be working.
and still be working.
Yeah.
And it's quite frustrating to be not. And so the funny thing about this is, this kind of an hearing loss is different from what children get, because they have never been exposed to sound. So for them, it's not that distressing. For age-related hearing loss, like what we just saw, that we were able to hear up to 12,000, but he was able to hear up to 18,000,
Yeah.
right? Which means if he is trying to talk to us at a frequency between 12,000 to 8, so he will think that why these two people are not responding. They are not listening to me. They're ignoring me. I'm trying to make them understand. So this is something known as a speech discrimination, which means we can see that he's saying something.
Yeah.
We will hear all the consonant vowels which are less than 12,000 frequency, but the moment any sentence or any word or anything
down.
that is, so we will only hear parts of it. And since now we are older, we are wiser, and we have much more egos, we don't want to accept that we
Yeah.
are not hearing what you are saying. So it comes with a lot of emotional and anxieties and kind of things which are beyond
Yeah, like I can imagine, say, a 75-year-old grandfather who has always been used to having his way.
Yes.
Or, being in charge of his office or whatever. At home, now, if he's not able to hear 30% of the words that is being said, he might not admit it.
he might not admit.
He might just pretend that he heard it, and he might get irritated.
Or he may just yell at the youngster saying, "You never told me."
Yes.
Yes.
So he might divert his frustration at himself at
In a
other
different
people.
way, yes.
And people think that अरे अभी दादाजी बहुत चिढ़ रहे हैं आजकल.
So there is a whole data, Siddharth, which says that hearing loss in adults have increased the chances of them developing Alzheimer's.
Yeah.
This is a very scary data. That comes that the chances of you developing neurological issues like Alzheimer's and all is much more higher in patients with hearing loss. And if you can reverse that, or if you can take care of that, your incidence and even the progression of developing Alzheimer's comes down. Because brain, you are no but better person than you to tell how all the neural things are connected to each other.
Yeah.
But that is something which needs to be really, really, looked on now. Right?
So the reason that I really like this test is that it gives you a different marker to see your age.
Yes.
And ultimately, degeneration happens in parallel through the
Yes,
body.
yes.
It's unlikely that you will have extremely good hearing,
Yes.
but very poor memory.
Yes. Yes.
Right? Unless something specific has damaged your memory area in the brain.
Right.
If it is age-related degeneration,
Yeah.
roughly speaking, your body ages
Is
around the same
around
way.
the same.
Similar for bone age,
Yes,
similar for heart
yes,
age.
yes.
Because your body, if one organ suffers, then eventually others also
Yes.
suffer.
And as you said that this is such an important stimulus that is going to your brain.
Yeah.
Your memory, your conversion of your short term into a long term memory thing, your cognition overall
Yeah.
is very much linked to what you are hearing.
Yeah.
So even surprisingly, I must tell you this: cochlear implants were actually devised or invented for elderly people. Abroad in Australia and all, government gives cochlear implant as an insurance scheme to elderly people. Much later, they got approved for children. But in India, there is a thought process where children are considered important, but the older people are not. For example, if you have to spend 10 lakh rupees, you'll spend it on your child,
Yeah.
health or well-being. but you won't spend it on your 70-year-old father. In fact, father will only say कि मैं अभी 70 का हो गया, क्यों करना मेरे पे? But that's not what is going to happen with our generation, or because we would want a best life for us even at 70, right?
Of course. Of course. One more question about noise pollution. It feels like we are headed down this path anyway. There is no real escaping noise. So are there things that we can do to take care of our hearing, given that we are living in cities?
Yeah.
And we can't really afford to move anywhere? What can we do to take care of it, to just reduce or slow down this aging process?
So certain few oral hygiene things that I always say is, of course, there are things like, underlying diabetes, blood pressure, general autoimmune issues that the incidence of autoimmune is also increasing, and hence your hearing losses are also increasing. Those things. Eat as healthy as possible.
Okay.
Lot of we give a lot of nerve related multivitamins so that your neuronal functions are staying active. Much more than that, and that's purely my personal thing which I've said is, you need to just calm down, and stress has to be under control. Stress is the most distressing thing that your body can experience, and it has been proven in multiple aspects, whether it's your hearing or other issues. So things like meditation and doing a lot of those calming things go a long way. And they go a long way. I mean, generally just keep yourself hydrated so that all these functions, water is such an important component. Keep yourself hydrated, manage your stress well, don't be in that whole rush. Don't go for any fancy things like wearing those earbuds and gadgets like things. Just be as normal as you can. Like, try to become as conventional as possible.
Got it.
Use the technology to your advantage, and don't fall for.
I have one doubt. There are headphones that conduct sound through bone.
Yes.
So bone conducting headphones,
Yes.
basically. Are they healthier?
They are definitely healthier because I would say healthier in a way is because they're not directly impacting your eardrum in a way the air conduction thing is happening. But again, one thing is, mostly we have seen a problem that the sound is not that great as compared to the air conduction. Some companies have come up with a very nice technologies, but at the same time, again, what we are talking about is inner hair cells. Whether you are stimulating it through the air conduction by putting them in your ear canal, or you're stimulating it with your bone conduction, it is about the intensity or the how high the sound is.
Right.
So even a high intensity bone conduction devices are going to cause.
Can also harm the hair cells. There are some myths around hearing that a lot of people have, so I wanted to break them with you. First of all, say if a child cannot hear, a 1-year-old child, a lot of parents might say, "ये अपने आप ठीक हो जाएगा." Is that true?
No. So again, there are two components of hearing. Hearing is not hearing. Hearing is for them, जो अपने आप ठीक होगा is speech acquisition. So as long I tell the parents, as long as you confirm it to me that your child is hearing normally, you can wait for whatever time until there is a time you need to see a neurologist where you need to figure out whether he's able to process the information he's getting from the auditory stimulus. Hearing loss अपने आप ठीक हो जाएगा, it's an absolute myth. If your child has a hearing loss, he has a hearing loss. If it is a proven on report, there are a lot of parents who say कि father भी late बात करने लगे थे, grandfather भी, इसका चाचा भी late बात करता था, तो ये भी late बात करेगा. You can wait for as long as you want if you are giving me a normal hearing report. So you need to separate these two things, that hearing loss अपने आप ठीक नहीं होता है. If your hearing is normal, your child may be a late speaker, which is a different problem altogether.
Correct. PRP, or platelet rich plasma, is now I think a treatment in fact you can count the number of things it is not a treatment
Yes. You can grow hair.
You can
look
grow
pretty.
hair, you can look pretty, you can have glowing skin,
Yes.
your joints can get better, you can score well in exams, anything. जहाँ पे doubt हो PRP डाल दो.
PRP डाल दो.
ठीक है.
And surprisingly, there are few centers that are putting PRP in your inner ears, claiming that you can reverse the hearing loss, which is such a big myth. Like, it's that's not the treatment. There's no study, no proven facts, nothing, absolutely nothing. It cost patient a bomb. It more than that, the loss of cost, it's the cost time that is lost, because they keep on waiting. They repeat the bera after 6 months, or they repeat the hearing test, and again after 1 year they keep on putting that PRP. It's absolutely
Okay, so don't go for PRP if you can't do anything else. Another myth is that cochlear surgeries are brain surgeries.
Oh, no. So, cochlear surgeries are not brain surgeries. So the only thing that is close is that ear is close to your brain. The cochlear implants are just put in the cochlea, and cochlea is the innermost part of the ear. So you're not fiddling, you're not opening the brain. It's like any other ear surgery, but much more advanced when I just talk about the ear surgery part of it, because now you are opening up the inner ear, you're dealing with implant that is going into your inner ear, but it has no relation with your brain. You're not stimulating any part of the brain externally, you're not touching any part of the brain. So it's not a brain surgery, it's a pure ear surgery, little more advanced than a routine ear surgery.
Another myth is, if your child has, say if you have 2 children and both of them have hearing loss, fix one ear of both.
So unfortunately, Siddharth, that is what is happening all across the nation. All the government programs that have come, and even in Mumbai that we run, most of the donors are giving implant only for one side, because the aim is that you give them hearing, and hence they are able to acquire language from one side, which is not, I won't say is a myth, or it's not untrue. It's almost like try to hear it from one side, try to see from one side. There's a reason why God gave you two things. So all the components that we were talking, that localization of the sound, directionality of the sound, emotional component or depth of the sound, it will only come when you have hearing access from both the sides. So very typically, what I have seen in my patients is that children who were implanted in initial, like a 1-year-old or 2-year-old, and they started taking therapy, of course the language acquisition was brilliant, because next 2-3 years they're taking therapy, they're always tagging along with their parents. The moment they go into the mainstream, like a 5-year-old child will start going to the school, and there he's independent. So he's not able to hear what the teacher is saying from this side, what the students are saying from this side, and then we see there is a drop in his confidence, his language, he then starts to go down, and then they come up with that. So it's best, I would really urge all the government programs, all the donors, and everybody who's into this thing, that don't go for half helping. If you really want to help somebody wholeheartedly. It's almost like, you see somebody, a beggar or somebody who needs to buy food, and the cost of the food is $100, but you go and give them 25 rupees and say, dekh lo abhi kya karna. Now he has 25 rupees, he still can't eat food, but he has some money, he's still waiting to reach there. So that's not really a help. You are just giving them a taste of what it is to be in a hearing world. So I would still say that, so if that is the situation, we have come across this thing, I tell them, okay, do one side each for both the children, but within 3 months please do the other side. But that comes with, of course, 2 surgeries, all these things. So
there's no easy answer, but yes,
there's no easy answer. I know people keep saying the resources are limited, and I don't think India has limited resources. India has immense potential, immense resources, and again, understand, these are the people who are going to be your future. They are going to give back much more than what they are taking from you.
Shruti, thank you so much for doing this. I think there will be a lot of questions that the audience will have. If so, drop it in the comments. We'll have Shruti back. We'll do another conversation on this. In the meantime, thank you.
Thank you so much. It was lovely. I feel I could just pour my heart out and give out that message which needs to reach.
Beautiful.
Thank you so much. Thank you.
Cheers, guys.